So we haven't done one of these for a while, but now is the time, as we have a few things to bring you up to speed on now that we're back. So bear with me, there's quite a bit to cover. Over the past 6 weeks or so, we've pretty much cleared the backlog of those of you who have been suffering with urgent dental problems over the lockdown period. So now we can begin getting things back on track with routine dental care, albeit slightly differently to how things used to be. We've been very fortunate here at the practice to have been able to source all the gold standard PPE and protocols to ensure the highest standards of safety for all our patients and the dental team, so you can be confident that you'll be coming into a safe and secure environment. So let's start with appointments. So many of you have had to miss appointments in April, May and June for either your regular checkup and hygienist appointments, or you may have been partway through a course of treatment. There'll also be many of you with future appointments in your diaries which you had pre-booked earlier in the year before we had to close. So what on earth is happening? Good question. For those of you who had to miss your appointments in the last few months, we'll be giving you a call in the next week or two to get you booked back in. However, we are aware that some of you are still not ready to venture out unless absolutely necessary, and that's fine. We'll work with you to fit in whatever best suits your situation. We can reserve you an appointment towards perhaps the end of the autumn, or if you just want to leave everything for now, no problem, just let us know and we'll leave it up to you to contact us when you're ready. We'll also be resuming our recall system for those of you who have your appointments sent out by card or email, and we'll be starting with sending out appointments for August and September in the usual way. However, as we have so much catching up to do, you may find that they arrive with a little bit more notice than we would normally give you. So if on receiving your appointment you find that you can't make it and would like to change the date, we'd be really grateful for as much notice as you can possibly give us. If you have a pre-arranged appointment in your diary and don't know whether to keep it, well, it depends on what it's for. If it's just for a checkup, it should be fine. But if there's a hygienist appointment involved, we may need to juggle dates and times around a little bit, as things aren't quite back to normal in the hygiene book just yet, and aren't likely to be until late August, maybe even September. However, we will be calling those of you with pre-booked appointments to check whether you're happy to come in, or we may need to tinker with the date or time. Also, we'll need to call everyone a week or so prior to any booked appointments, as we're currently having to ask some screening questions regarding COVID, just to check that it's okay for you to come in. We'll also let you know the current procedure for attending the practice, which is a little different from how it normally is. The previous video will talk you through how attending the practice has changed. But don't worry, we may all look a little bit different, but it's the same us beneath all the masks and gowns. Please try to come alone to any appointments, excepting parents and carers, of course. In the interests of social distancing, we're trying to limit the number of patients in the waiting room at any one time to a minimum. So if somebody comes with you to your appointment and they don't need to come in, please could we ask that they either wait for you in the car or perhaps do a bit of shopping. On the vexed question of masks and whether you need to wear them here, the new government guidance exempts dental practices from insisting that patients wear a mask whilst on the premises. As you know, we're trying to limit your contact with other patients. However, we're very happy to encourage you to wear a mask just in case you do find yourself in the waiting room with another patient for any period of time. With all the extra phone calls we'll be making, and with patients having to call us from the car park, our phone is obviously going to be much busier than normal, so please bear with us if we seem to be constantly engaged. Our phone system logs any unanswered calls, so we will try to call you back if we've missed you. Or if you just drop me a quick email saying you've been trying to get through, I'll either call you or email you back as soon as I can. The appointment book. It's proving to be a bit of a challenge at the moment as we're having to book gaps between certain appointments. So in the albeit unlikely event that the guidance changes, we may call you to ask you to slightly alter the time of your appointment. However, it'll just be either 10-20 minutes earlier or later. So, as I said earlier, things are certainly a bit different around here at the moment, and we have no idea how long things will stay this way. Hopefully not too long, but in the meantime, just a great big thank you from all of us here for all your loyalty and patience over the past few months. And to those of you who've been in to see us since we reopened, thank you so much for complying with all the new protocols which have been put in place to keep us all safe. Thank you.